now it's time for our last, but definitely not least presentation today. And it's going to be given by Professor Maria Reich, a liver cancer expert from Barcelona Clinic Liver Cancer Group Liver Unit in Spain. And it's always nice to hear some good examples. And Professor Reich is going to present us the good example of collaboration at EU level and Horizon projects. Maria, please.
Thank you very much for the invitation, and it's a pleasure to present good examples because I believe during the last 10 years we have a lot of collaborations at Europe and international level. Next slide, please. The first thing that I did is a search about the liver cancer at Codis, and as you can see here, the next one. Perhaps, and could you put the next slide, please? We have several options at European level. 69 focus on liver cancer. However, when we focus on liver screening, the numbers are lower. Next slide, please. We have 4 options, for example, here of the 69 that we have in this regard. And the most important thing is only one was focused on children. It's important to mention that this disease is also in some children, but it is not the most frequent tumor in them. But the other point that I would like to emphasize at this level is the only one who have 26 centers is this project in children. The other have only 2-3 centers. So in this regard, good examples not focus on screening, so it is an opportunity to work on that. And we need to consider the academic register that we have to explain the collaboration at European level. The next one, please. Here is a good example. It was done during the first wave of the pandemic. 66 centers around the world was participated in this study, but I would like to emphasize in Europe, as you can see here, 55 European centers were connected at that time. We did a survey about the impact of the COVID pandemic on liver cancer, and as you can see here, 80.09% of the centers canceled the screening program. This is a huge impact for the next year. And the other important message for that study was related to the teamwork at that time that is also applicable on liver cancer. As you can see here, the oncology nurses were key members to transformation the face-to-face visit to the digital visit. So we are online at the European level in this regard. We need to have more and more data in this topic. Digital management of patients is something that we need to work on, but at least from the liver cancer field, we already have data in this regard. The next one, please. The other 3 examples that I would like to share with you are related to ATC. As you can see here, there are a network for 23 European centers, more than 1,000 patients. But the key message here is not the result of this study. The key message for this slide is the multidisciplinary approach on all of the study or academic registers that we have in the field of liver cancer. For example, in this example, hepatologists and statisticians were the leaders of this project, and that's why we have the result that we have at this stage. The second example, next one, please. It's related to another liver cancer tumor that is cholangiocarcinoma. This is the network that is called EASL, 34 centers from Europe. As you can see here, more than 4,000 patients with cholangiocarcinoma. And again, the leadership is not only for one group of physicians related to the disease, it's biochemistry, hepatologists, and biologists. And the last example from this slide, next one, is the other approach that is the register for this very rare tumor that we have in our patients, hemangioma or fibrolamellar ATC. And this is a project that started from EASL. This year, 2 of the grants from EASL are focused on rare tumors. And again, radiologists and oncologists were part of this project and they lead the project. So the key message for the good example that we have in liver cancer is the multidisciplinary team and leadership in this field. The next one, please. Next one. However, when we talk about cancer, we are faces, as was presented in the previous presentation, that we have 2 streams of patients, those who have at risk of cancer, developed cancer, have the chance, for example, liver transplantation. In this network, the liver transplantation center, they also were very well organized. Here we have an example from another type of initiative from the associations. ELITA, EASL, and ILTS did a survey for these 470 centers. However, only 29 from Europe. On the other side, we have those patients who have advanced HCC or who have some specific disease, such as dialysis. And that's why I would like to show you also a good example for this very few number of patients that also have the disease, but we do not have information from randomized clinical trials. So the next slide, please. The next. Here is an example for academic research, 44 centers around the world, for only 22 patients who presented advanced HCC and dialysis. This group of patients now have also information about the safety of specific treatment. It is not important the treatment that we evaluated at that time. The idea is to show how do we organize to have results for all patients that have liver cancer. The next slide, please. And this one, the last one, is another example for patients who presented advanced HCC and also had prior history of liver transplantation. This is a very special population, as you can see here, 28 centers, 28 patients. That means 1 patient per center, but we also have the capacity to organize the center, the physician, and have results for these patients. So the key message for this slide, it is not only important the incidence of the disease or the profile of the patient, we need to be connected to have results for everyone. And the last slide that I have, please. The last slide is good example. How do we extrapolate all of this idea in screening? The next slide, please. As we mentioned before, we have a population at risk. We also have some tools for screening, but we need to improve. Why? Because we know that the patients improve their overall survival if we focus on that patient who are really at risk of liver cancer. The next 2 slides, please. So here I'd like to finish my presentation. How do we improve at liver cancer screening and diagnosis at the European level? I believe that based on the experience that we have in coordination between the specialists that really involved in that, education for patients to be confident for their screening, and also optimization of the human and healthcare resources. So I'm very happy to listen to the previous talk from Professor Basu, because we are exactly in the same line. The good results were based on this profile. And here's the example. Research's project was a screening program with adherence as 96% at first year, 80% also during the pandemic, and all but 1 patient presented a more than very early HCC. So the key message here is the coordination, where the nurses are involved in liver cancer, increase the adherence of patients, and again, the hepatologists, radiologists, pathologists, or teamwork is the key things for a good example, at least in my point of view. So with this slide, I would like to finish, and thanks again for the invitation.